Okay, so my husband and I are off to the races. I really don't know what to expect because I've never done anything remotely like this. I've worked in the beauty industry, like hair, spa, that type of stuff since 2005, but I've never even consulted with a plastic surgeon on anything. So I'm pretty excited, and today's my birthday, so I'm 44, and today is going to be my first consultation with a plastic surgeon, and we're just gonna see what he has to say, what he thinks, and then we'll just go from there. And I was thinking about, I don't know, I guess the options or whatever for a lip filler.
Okay.
And
now, have your lips changed since you've gotten older?
Oh yeah, I think so. I feel like it's a little deflated.
Okay, so they're thinner than they were.
A little bit. I think so.
So there are different things that we can do.
Okay.
One of the things that I look for is the definition of the white roll, which is right at the edge of the lip here, where the skin and the vermilion meet. And normally there's a fairly defined. Now you have some lipstick on and some liner, so it's not. But one of the things that we can do is define that a little bit more. In your case, you don't have little fine lines, that at rest, and so that wouldn't be an issue. If you did, that would help, lipstick bleed and stuff like that. But in your case, it would just define a little bit more this area.
Okay.
But that would not be enough, and if we only did that and filled it a lot, it could create duck lips or something like that, which we don't want. So I would also probably, in addition to that, put a little filler here, and that would plump out the lips. And what I do is I usually like to go one syringe at a time. I think one would be more than enough to begin with. Let a week go by, and then if you feel that that's enough, fine. If you think you need more, go ahead and do that. It's hard to tell. Once you put the needle in, just the fact that you're putting a needle in will cause some sort of swelling, and so the immediate result that you see isn't what's going to be there a week later.
Okay. And then I have these all the time, like these little puffy bags, and I hate them. And I don't know what to do about them. I don't know I don't know what you do about that. Can you do anything about that?
Just look at my finger. Don't move your head, and just follow my finger. So when I see you looking up, and that's the point where there's fat that surrounds the eye, and this fat is held in place by a membrane that goes from the edge of the bone up to the cartilage in the eye, and so the fat's behind it. That membrane arises from inside the bone. So as we get older, and sometimes just people, the way that they're genetically put together, the membrane can be a little bit looser. And because it's sort of tight, it's kind of like when if somebody has a little bit of a pot belly and they tuck in their pants, it still hangs over a little bit. So the fat, you can see the line. And the question is, in any given person, whether it's better to try to put in some filler to bring it up to that level, or if you do that, is that going to create a bigger bag? And you don't want suitcases under your eyes. The thing about trying to remove fat from that area, there are two things. You don't want to do surgery if you don't have to, but really surgical is the only way there's no way to safely aspirate fat from that area. it would probably be best, if you wanted to remove the fat, to go from inside, make an incision on the inside of the lid, and then that goes right directly to the fat and just remove some. Yeah, a little bit. The problem is, fat in the face is very, very valuable, because as we grow older, we lose it. Okay, and when I was taught, I trained in early 1980s. All lower lid blepharoplasties were make an incision, remove the fat. And there came a point where that thinking changed. And I remember after I came back from a conference and they had told us about this, I started looking back through my pictures, and sure enough, everybody, the post-op pictures that I had removed fat had maybe not a gaunt look, but yes, exactly. And that's when I said, oh, you know what, I need to not remove it. So the options, if you're not going to remove it, are twofold. Number one, you can redistribute it. You can make an incision and get to where the fat is, incise the membrane, and then pull the fat out and then sew it to fill that area. The thing about that is that's a big operation. That is not a little deal. You have to do things to prevent this from happening. You have to tighten the lower lid. I mean, there are a lot of things that you have to do. It's a pretty big deal. Now, it works, but in your case, you may or may not have extra skin, but if you do, it's not much. So I would opt trying the filler.
Okay.
Because
that would fill this little.
Yeah, we would fill in on both.
Okay.
Now there are a couple of things that you have to understand about that could be a problem. Okay. First, the way we do it is you come in an hour beforehand. I put cream on, and numbing cream, and then you just sit for an hour. It takes an hour for it. Now, it doesn't completely numb it up, but it numbs it up enough so that it's not an issue. I then use a needle. It's pretty small. It's like about 27 or 25 gauge needle to just make a little hole in the skin. Then I have this other needle that is a blunt needle that has a port, a little hole on the side, not at the end. Okay, and I use that to fill. Okay, so I come in and fill, and then with my finger I smooth it out. And I actually, this is one of the few cases where I tell people that when I get home, they can go ahead and try to further do that. So the thing that's the unknown is that going to make it look heavy? If it does, there is an enzyme that we can inject that gets it rid of it. Okay. However, there are times when some of this material can go into lymphatics or something and get into this area here, okay, and make that puffy. I haven't seen it, but that's one of the risks that people talk about. So be aware that can happen. You don't have it, but mailer bags here are very difficult to deal with. Okay. And I mean, there's no good solution for people that have that. Okay. And you don't have them, but I'm saying that that was one of the minimal risks that you.
And then so. Well, if I'll put this in a video, but I gained 50 pounds. I'm on track to losing it. But anyway, these little jowls, they don't like that.
I'm going to have you sit up for this one here.
So I know I'm talking about a whole lot right now, but I just got one here. You could tell me what you think and
okay. So hold the mirror. And if I were to do something that resulted in that, would that be enough?
Yeah.
Okay. Because the other thing that we can do, depending on how much, if there is some and it doesn't, it's hard to know as you lose weight where you're going to lose it. If you lose it from that area, then great. If you don't, and everybody's different, I can, as part of the procedure, do a little liposuction in this area to help, because a mini facelift, which is what I'm talking about, does not primarily work on here, okay?
Yeah.
It primarily is right here. And what I do is make an incision. Now, you see this hair here? Normally that is lost.
Okay.
Because the incision goes up in here.
Okay.
And, you know, as the skin is pulled up, whatever hair-bearing skin is at the edge is trimmed, okay? There are ways that you can slant the incision a little bit so that you don't lose as much hair, but
I don't think that would bother me too much.
But it does somebody, but some people are bothered by that. That's why I
have
mentioned
such long hair.
Okay. So anyway, so the incision is here. It goes along here, over the cartilage in the ear, around the earlobe, and then ends up back here.
Okay.
Okay. Through that incision, I lift up this area here.
Okay.
Now, the parotid gland is a salivary gland that's right here. The covering of the parotid gland is very tough and holds stitches really well. It is also in continuity with the muscles that move the face. So, what I do is make an elliptical incision here. Now, for people that have thin faces, and you're sort of in between. It's not thin, it's not heavy. It's in between. So when I make this incision, there's a little island of fascia that's there. I can either remove it or sew the edges over it. And we discussed, if I sew the edges over it, you'll still maintain some fullness, and some of that would actually get pushed this way, which might not be a bad idea for you, but we could discuss that. In either case, when you take the edges of that and sew them together, that is what creates this, and that's what holds it. The skin alone does not hold up a facelift, okay? Because if I were to just remove skin and pull up, it would look great. It would look great for about 3 to 6 weeks. And then after that, it would drip, right? So, that's what holds it. Then the rest of the operation is just removing the extra skin. And I'm not trying to tighten really hard, I just remove the extra. Now, if you've sewn 2 pieces of fabric that were not of equal length, you know that you have pleats. Okay? So, and this is no different. All of the pleats are hidden back here. Okay?
Okay, that makes sense.
And with time, I mean, at first you could feel a little sort of bumpy, but then that smooths out.
Okay, and I think we covered almost everything. These probably bother me the most out of everything.
Okay, so I want you to just relax your face. So when you are at rest, they are still there. Those are lines that are created by 2 muscles, one here and one here. These are the only 2 muscles that lift the brow. So we have to treat them with care, because if we relax them too much, your brows can drop. Normally, the most important part of the brow that needs to stay up is the outside part. Okay, so and also happily, most of your the lines are in the center. And so we could relax the muscle here, still keep it active here so your brow doesn't drop. They will separate maybe a little bit and maybe go down in the center, but up here they go.
Okay.
And what I like to do is use Botox to do that. And then after the Botox has taken effect, see what's still there, and there'll still be something there, and then use a filler to smoothen it.
To make it smooth.
Smoother.
Right.
Completely, radically, but that.
Right. Okay. And is there a way to? Okay, so do you remember that lady from Dirty Dancing who had a nose job and completely looked different? This hump has always bothered me, but I'm afraid to take it out. Like, I'm scared it would make me look completely different. And
what we could do, non-surgical and reversible, is use filler up here to make it less bumpy.
So it would bring it out a little bit. Okay. And yeah, I think that's it. I think that's my whole face that we've covered. So Yeah, and what cost for for these? Like, what would you think the cost would be for that much Botox?
They need about 25 units,
25.
which is, and that's about $350.
Okay, that's not bad at all. And results with that, is that 3 to 6 months? Or
It's 3 months,
3 months?
Maybe 4 months.
Okay.
Now, for people that keep coming back, a large number of them see that the results last longer.
Okay.
And after 2 or 3 years, I may have some people who come back every 6 to 8 months.
Oh,
But
okay.
I can't guarantee
Right,
that.
right.
Most of the time, it is 3 to 4 months.
Just coming in and having a little maintenance done or whatever.
Yeah.
Okay, that's perfect. And I'm sorry, it's distracting.
That's it.
Okay, and then the lip filler is which one? Because I know there was 2.
Yeah, I could probably use Velour. I can use the Juvederm. They're both the same material. It's just made a little cross-linked a little differently.
Okay.
What I like about the Velour is it's more elastic.
Okay.
And in an area like this, that's what you need.
Yeah.
If for people that want me to fill this or other thicker areas, then I use the other Juvederm.
Okay. And what would be the cost for the one you want to use?
It's $600.
$600.
And the Juvederm, the regular is like $570 something.
Okay. And is that something I can come in and just do when I'm ready? Okay. All right. And then how much would that filler be?
If you were to get this, I would say let's try to use the same because you don't need a lot.
Okay.
And it comes in 1 cc syringes. And 1 cc is much more than, and you have to sell the whole syringe because I can't divide
So
it.
you could use it on my lips and
yeah.
Oh, that's awesome. Okay.
Or nose and hair.
Yeah, that's pretty cool. Okay, I didn't know that. I like that idea. Okay, I guess that's it. Okay, so obviously we've just left the plastic surgeon's office, and I'm going to link his office down below for anyone who is in the Roanoke, Virginia area who wants to go and see him. His name is Dr. Silberblatt. So what we've decided to do, he does Botox on Fridays, and because I will be getting a lip filler and Botox, and you can only buy 1 syringe at a time, we're going to do my lips, we're going to do Botox, and then with the rest of the filler that he would use in my lips, he's going to also put right here so that there won't be so much of a dent in my nose, and then use the rest of the filler in my forehead area to kind of take out the rest of the lines that the Botox wouldn't take care of. So that will be in a future video. Right now we are saving for our house and doing that kind of thing, so that will probably be in the next several months that we'll come back and actually do the work. So I don't know, but anyway, I will see you guys in a future video, and I hope you enjoyed this, and I hope it was educational. It certainly taught me some things. I definitely am not gonna fool with these. I'll just use ice packs and whatever, but I think that under eye sounds too invasive for me, and I don't know if I want to use any filler there, since he did say it can kind of drop down, so I probably won't be fooling with that part of my face. But in a future video you will see the Botox and the filler in the other areas of my face. Stay encouraged.